for his report and for the COVID report.
All right, good morning, supervisors. We're going to start with Dr. Willis giving the COVID-19 update, and then I just have a couple of housekeeping items after that.
Good morning, everyone. Good morning, supervisors. Nice to be here with you this morning. We've got a lot of ground to cover with regards to our COVID-19 response, so I'll start right in with our numbers. Next slide, please. So this is our numbers from the beginning of the pandemic in Marin. We've had about 5,000 cases with about 1,000 deaths, which is a 2% mortality rate across the board. Next, please. This is our hospitalizations and ICU visits in Marin. You can see there an increase. We had about 5 people in the hospital for the majority of the month of October, and there was a spike up to 13 in the hospital last week, down to 9 now, and we'll talk more about what's contributing to that. Next, please. This is our epidemic curve, the number of new cases per day in Marin. You see there July, our most significant surge occurred in early to mid-July, and then we've seen relatively progressive declines since then, with the exception of just in the past week or 2 weeks, there on the far right, the beginning of increase in cases, which is part of a state and national resurgence of COVID-19 that we'll focus on. Next, please. So comparing that epidemic curve in Marin to this one, this is the state of California, and you can see that there's been a dramatic increase in cases across the state since the beginning of November. Next, please. And this just offers a visual so that you can compare the California rates versus the Marin County rates. And you can see that while we shared that spike in July, we have not been experiencing quite as much of the surge that the rest of the state has experienced since early November, but we are seeing a milder version of that same acceleration. Next, please. And then stepping back even further to the United States, what we see is that that July peak was much lower than the current peak. In fact, we're really seeing a rapid increase and a surge in cases in the United States that is unprecedented thus far in the pandemic. Next, please. And this is another way of describing that. This shows the number of cases in different states. And despite the fact that we are seeing surges in California, there on the far left, you can see that we're actually in that second lowest tier of cases compared to other parts, especially the upper Midwest, that are having case rates that are 10 times or more the rates that we're experiencing in California. What's important about this is that in the previous surge that happened in July, it was geographically separated. There was areas of New York, there was California, there was the Southeast where we were seeing surges, but other areas were relatively spared. Currently now, the entire nation is seeing surges in cases, which makes it more difficult to move resources from one part of the country to another, especially with regards to medical staff, and we're seeing surges in hospitals. Next, please. And then again, stepping even further back, this is the global picture. And unfortunately, we're seeing similar surges in cases in other parts of the world, especially Northern Hemisphere. Europe is seeing similar increases in cases with similar restrictions and lockdowns that are happening in most European countries. Next, please. This was the slide from the governor's announcement yesterday. He held a press conference that really sounded the alarm that it's time to put on what he referred to as the emergency brake on our blueprint for a safer reopening, and highlighted that the rate of increase that we saw in our first surge in that later June into July period was less than the current rate of increase across the state now. We saw a 51% increase in cases just in that first week of November across the state. And what's important about that from an epidemiologic standpoint is that the slope of that curve often predicts the height of the peak. And so when we see a very steep slope and increase in cases, the concern is that that second wave that we might see might, unless we do something now and do something aggressive, might lead to a much higher overall peak with a greater number of overall cases. Next, please. So the governor announced, and this is from his press conference yesterday, that he's putting on the emergency brake for the state. And if we go back, this is the update I offered you on the left slide. This was our status last week, and this corresponds to the slides I would have shared with you in the information last week. There were at that time 13 counties in purple, 22 in red, 17 in orange. We were one of those orange counties. Now moving to the right, 41 counties have been moved into purple, and many counties actually accelerated from orange straight into the purple through the red tier. Now 95% of the residents of the state of California are in a county that is in the purple tier, because it includes all of those southern counties that have the highest populations. Los Angeles County, 10 million residents, for example, and the majority of Bay Area counties as well, with the exception of Marin, San Francisco, and San Mateo currently are in red, although those other two Bay Area counties have case rates that are much closer to purple than those in Marin. Next, please. So this on the left shows our case rates. Now we have 6.2 new cases per 100,000 residents, which adjusts because we have high testing rates, adjust down to 4.3, which brings us just into that red tier. We almost actually squeaked into the orange tier again for this week, but we are, unfortunately seeing rapid increases in cases. Also, you see our percent positivity rate is largely unchanged at about 1.5% overall and 1.3% for the health equity quartile. That's our lowest income communities. This is something that we would expect to change soon because it's changing across the state and across the region. But I think we can rest assured that there is something that we are doing right, because we are not experiencing the same velocity of surge as we're seeing around us. We do not want to be falsely reassured that we would remain an island. And that's what we'll talk about, some of the most important protective measures we'll be taking from a policy standpoint shortly. On the right there, you see the statewide metric, 16.5 new cases per 100,000 residents per day, which is more than twice what we're seeing in Marin, with a 5.2% overall positivity rate statewide. Next, please. This shows our case rates in Marin. You can see there that over the month of October, we were in that orange tier, tier 3. This is the adjusted case rates. Again, when we have our actual number of cases, and then we're given credit for high testing rates, which brings it down. So we had an adjusted case rate of about 2 at the end of October. That adjusted case rate has increased now to 4.3. So we have about a doubling in our adjusted case rate just over the past couple weeks. Next, please. One of the important characteristics of what we're experiencing in Marin is that there's been a shift in the demographics of our experience with this pandemic. As we all recall, earlier, for the first few months of this pandemic, it was really a story about the disproportional impact in certain communities characterized by race, ethnicity, characterized by economic opportunities, characterized by where they live, San Rafael Canal District, certain parts of Novato, with up to, in some weeks, up to 80 to 90% of our cases being among people that really didn't have the choice to safely isolate and distance by virtue of the fact that they were essential workers, relying on everyday work to make ends meet, and then living in households where transmission was more common. It's now, if you look at the last month of cases, or the last 3 weeks, the majority of cases are among our white residents. And we're finding a greater proportion of those cases among people who are gathering indoors, and might have a more reasonable option to avoid those exposures because they're based on personal choices. So it's both discouraging that that's what's driving it, but also encouraging because we think those are behaviors that people would have more control over because it's not a matter of economic necessity. Next, please. This is the school status. So every week I'll be sharing with you where we are with regards to our school reopenings. We are still moving forward successfully with reopening schools. Now 71% of schools in Marin County are reopened to some form of classroom-based learning. 82 schools of our 106 are open. We have about 250,000 accumulated student days since September 8th, when we first started reopening schools in that purple status, when they had to reopen through a waiver process from the public health officer. Over that period of time, we've accumulated a total of 15 cases among students and 1 case among staff. There have been no occasions of transmission on a school campus between either students and staff or staff to students. All of the cases that I'm showing here, the 15 and the 1, are people who acquired the infection in the community, either at home or elsewhere, and were identified as being part of that school community. So we count them as cases, but they're importantly, they are not attributable to the school environment. Next, please. So we are moving with the state in adopting new restrictions and responding to this surge. In our case, we are being, obviously the governor moved us into the red tier yesterday to go into effect today. That's a step that we had chosen to take voluntarily as a preemptive step last week. So it's no change in terms of the actual policy, because it's just different in that now we're operating under the state order, whereas we had intended to operate under a county order if the state had not taken that measure. We are now, so the changes are indoor retail establishment, indoor malls are reducing to 50% capacity. We are closing out restaurants to only allow for outdoor service. Places of worship are at 25% capacity. Movie theaters are 25% capacity with no concessions in theaters. Gyms and fitness centers have moved to 10% capacity indoors, no longer allowing indoor pools. Libraries are down to 50% capacity, and office workspaces have reverted back to only for essential workers, whereas in the orange tier, it had allowed non-essential and essential office workers. Those are the primary changes that will go into effect today. Next, please. And just want to highlight a minute the indoor dining risks, because we are in red tier plus, if you will. So we're adopting all of the red tier policies. The state is now requiring that, but we are taking the additional step of closing indoor dining, which normally corresponds to the purple tier. Again, 95% of the state is now in that purple tier. So indoor dining, there are very few locations across the state where any indoor dining would be allowed. The reason we chose to take that step in Marin is that we recognize that indoor dining presents particular risk. It is a gathering indoors where people are across households. It's in a setting where people cannot cover their faces indoors because they're eating and drinking, often prolonged period of exposure, an hour to an hour and a half. You know that the duration of exposure, as well as the proximity and the presence or absence of facial covering, are really kind of the key factors if you're indoors for the risk of transmission. We know this also in our own data that when we look at the occupation of our cases among people who are essential workers, food service workers are among the most common in terms of percent positivity. So we know that's one of the higher risk groups. There's more and more literature that super spreader events are traceable back to indoor dining experiences. So someone may be actively infectious in a restaurant, especially if there's poor ventilation indoors, and other people in the context of contact tracing who had shared that space are revealed to have been cases when they do that investigation a week or so later. There's been a few famous outbreaks where 15 to 20, even 30 people who shared a given space that way were infected. So restaurants do contribute to that as well. And they also contribute to mobility as people are moving about and moving in the evenings to seek indoor dining. It contributes to overall mobility, which is another important principle of the shelter in place, is to really, we used to call it the shelter at home and shelter in place. The principle there is really, we're safer by maintaining that organizing our lives around staying indoors and staying close to our family and friends and those that are part of our household. The governor to that end is considering a curfew, which would also importantly limit overall mobility. No decision has been made on that yet, but it's something to signal for that may be coming by the end of the week. Next, please. So holiday gathering recommendations. This is something we released last week, and it's just more important than ever. Outside is safer. Gathering outdoors and following the safety guidelines that we've offered. Small gatherings, to limit them to no more than 3 households. That's now the law, is 3 households together are the maximum in that social bubble. We had started with 12 people in Marin as one of the pioneers of the social bubble concept here in the Bay Area. It became a state recommendation that we gather no more than 3 households together. Gatherings should be short, so no more than 2 hours, again, because it's both the proximity and the interval of time that contributes to risk. And then keeping the gathering stable, so not to participate in multiple gatherings of different households. So if you're fortunate enough to receive invitations to multiple gatherings, we really do need to pick our battles and really encourage people to stay with that hub, right? That hub of of your three households that you've chosen to travel with in terms of how you gather are the people you need to stick with through the holidays rather than jumping from one gathering group to another. Next, please. A travel advisory that was issued in Marin County last week and then reinforced by the state a few days later. The top recommendation is to avoid travel during the holidays completely outside of, moving in your car with your household to gather with people who are already in your social group outdoors in a safely distanced way. But if you must travel, we're recommending a 14-day quarantine for people after they return. And that's something that the state, again, reinforced as a tri-state recommendation. So Washington, Oregon, and California have now instituted a travel recommendation that anyone coming into these areas from other parts of the nation should quarantine for 14 days after they return. And again, if you do travel, remembering to take these best practices that we've defined, hopefully in Marin, and apply them wherever you are. In many other parts of the country, people are less adherent to those regulations, wearing your face covering, practicing physical distancing, sanitizing your hands frequently, and avoiding unsafe gatherings. If people are gathered together indoors and not covering their face, it's better to take a rain check. You might observe that environment as it is and choose not to even enter into that, offer your apologies, and go someplace safer. Next, please. COVID-19 testing options. So there have been some questions about where people can get tested. I think those questions have surfaced more frequently now because people are thinking about how they might use testing as a way to ensure safer travel. I want to be really clear that you cannot test your way out of the other recommendations. In other words, it's a misunderstanding to assume that if you just take a test and it's negative, then you can go ahead with what you had ever planned to do. The risk is still the same with travel. We want to make sure that people don't assume that if they have a negative test that it's safe for them to travel, because you could obviously, it only tells you about your status on that particular day. You could be infected in the course of travel. That's one of the reasons travel itself is a concern. But for those that are seeking testing, the first and most important message is to reach out to your medical provider. We have offered a public health order that all medical providers should be offering testing to all of their patients. It is a state law that medical providers and healthcare systems provide testing to their patients. More and more medical providers are doing so. Right now, one of the main, probably the largest single contributor to tests that are occurring in Marin County right now is Kaiser. Kaiser has really stepped up. We're doing over 1,000 tests per day for our residents. We have one of the highest testing rates in the state as a county, largely because of the fact that our medical providers have really stepped into the forefront for this and taken responsibility. Public health testing resources are being mobilized to do more mobile testing to identify and respond to clusters when they're occurring earlier. So whether it's in a workplace, whether it's in a skilled nursing facility or residential care facility for the elderly, whether it's in a school setting or a community like the canal area of Santa Fe, where we are seeing lots of cases in the geographic area, apartment complexes or block, where we can go there and do testing. That's the role of public health and testing. When it comes to baseline testing for the community as a whole, that really is the responsibility of our healthcare providers. COVID-19 is going to be with us for at least another year. Testing is going to be a key strategy for us ongoing, despite the fact that the vaccine may be coming in a few months. And so again, we need to see it as a core element of the provision of healthcare. So first, reach out to your doctor and ask for testing. If you're not able to get testing through your provider, there are other options. Self-referral. The public health testing is still available at the LHI site in Santa Fe. People can go online, register for an appointment, go get tested there. The state's going to be doubling our capacity there. So within a week or 2 weeks, we're going to be able to do 300 tests per day at that site. There's other that I've listed here. This is an incomplete list, but includes some of the key partners: Go Health, Marin Health, CVS Pharmacy offers testing. And then importantly, there's at-home self-testing with our FDA-approved mail-in products. Pixel by LabCorp, Everlywell, Vault, and Vidagene are all mail-in testing, and it's about a 2-day turnaround for those tests, and they're FDA-approved and are accurate. So these are all available at our website, which is coronavirus.marinhhs /testing, and you can just navigate to that on the website. Next, please. And quickly, vaccine update. So we have really good news. Pfizer and Moderna vaccine, they're both mRNA vaccines. They're in phase 3 trials, 40,000 patients each. Half received the placebo, half vaccine. So that's 80,000 patients total. And in both trials, they had about 90 COVID-19 cases. So that's really good news in terms of measuring the efficacy of the vaccine, because you need enough cases in the trials to actually see if it's effective. Half the group is given a placebo, half is given the vaccine. And then afterwards, they released the results to see who among the cases who received the actual vaccine versus who didn't. And almost all the cases that emerged in those study groups were in people who did not in fact receive the vaccine. And those who did receive the vaccine, very few cases emerged in that group, which is how you measure efficacy of a drug or a vaccine. So the conclusion there is that those vaccines are 90 to 95% effective, which is really good news. And especially good news that the Moderna product, just yesterday or the day before where these results came out, doesn't require the same level of refrigeration as the Pfizer vaccine. Pfizer was a negative 70 Celsius, very, very, ultra freezing and challenging from a logistical standpoint to have a cold chain that could actually store and move a vaccine that required such cold temperature. So Moderna, which is more conventional, it's a regular refrigeration that it's required. So that's going to open up some options for us. Next, please. Remember to get your flu shot. Your medical provider will be thrilled if you're also seeking testing. Right now, actually, it looks like Kaiser is going to be offering drive-through COVID-19 testing as well as drive-through flu shots. So get your flu shot if you haven't yet. We haven't seen any flu influenza yet. Normally it's going to start in a couple weeks. If this year's like last year or years before, it's in the next 2 weeks where we really start seeing influenza start rising in the community. So this is the time. Next, please. So in summary, COVID-19 surge is underway with widespread restrictions statewide. Marin County is in tier 2, the red. We are less restricted than most counties for now. Indoor gatherings are driving cases. Holiday gatherings and travel are not safe. We've had some promising vaccine news, and remember to get your flu shot. That concludes my presentation. Thank you.
Yeah, it's never over till we see that last slide. Thank you, Dr. Willis. Before I turn it over to board members for questions, just one thing on the testing front. Who should be seeking testing?
Yeah, the most important indication for testing is anyone who's having symptoms of COVID-19. The thing that what we don't want to miss is people who are infected and infectious to others. And the best way to diagnose COVID-19 is through a test. In fact, it's the only definitive way to diagnose COVID-19 for a test, is through a test. So I think the first point is if you're experiencing symptoms, so shortness of breath, fever, muscle aches, fatigue, the normal symptoms that go along with the early stages of a variety of viral infections, whether it's cold or influenza, those are situations where we want people to go ahead and seek testing immediately. The first would be to reach out to your medical provider. You could talk through the contingencies. They may want to do a televisit with you rather than have you come into the office. And then they might have a place. Many clinics have a respiratory clinic, what they call a respiratory clinic, which is outdoors under a tent where people can come in and get testing, or Kaiser drive-through testing. So the first is people who are having symptoms. The next is we've asked essential workers who are in public-facing jobs on a regular basis, who are at risk themselves of becoming infected, or at risk if they are infected to perhaps infect others within that workplace or even customers, to seek testing on a monthly basis. That's also included in the state law that healthcare providers must provide testing to asymptomatic essential workers. So anyone who's symptomatic and asymptomatic, whether or not you're having symptoms, if you're in that category of an essential worker, you should have testing at least monthly. Those are the two most important categories. And then if you know that you've been exposed, when we do a contact investigation and we determine that someone in a household has been exposed, we ask them to go get testing because that's someone else who's at higher risk. So those are kind of the default three highest categories: a known exposure to a known case, an essential worker, and someone who's having symptoms. Then there's others who are seeking testing for more from a reassurance standpoint. And that's a lower priority. And still, I think if people are concerned about their status, say if they return from travel, that quarantine period of 14 days, if someone tests 5 to 7 days after they've returned and they are negative, it's very unlikely that they've been infected. It doesn't mean that we don't recommend that full 14 days of quarantine. We still recommend that full 14 days of quarantine because some fraction of those people, even if they test negative, will be actually infectious. But it helps us understand, get a leg up on a more rapid response if they test positive.
Thank you. All right, board member questions. Supervisor Connolly, you want to get us going?
Sure, thanks. Good morning, everyone. Thank you, Dr. Willis, for the report. So in light of the increased case counts and Marin moving into a new tier, where do we stand with contact tracing? Do we have sufficient capacity now and for a surge in cases? And related, can you share some real life examples of what public health is learning from contact tracing?
Yes, one of the challenges logistically in responding to a pandemic is the extreme fluctuations in demand for you see right now quadrupling of cases in some parts of the country. So you staff for one setting and then you end up with four times the number of cases, and that's true for contact tracing, that's true for testing, et cetera. Fortunately, we have a great bullpen of contact tracers. Early, in the pandemic, March, April. We issued a call for people to come and volunteer for that work. We have the Marin Medical Reserve Corps that's always been there for us in disasters. Many of those Reserve Corps members learned how to do contact tracing and are available as kind of an extra pool for us. We've also expanded our own bullpen of just full-time staff doing contact tracing, 15 individuals who are full-time only doing that. And then it's extra up to 70 other individuals who are able to be pulled into that work as disaster service workers or volunteers. So we are keeping up with the demand as we see more cases. Our goal is every single person who's identified as a case is reached out to within 24 hours. When we don't reach them, it's because we don't have the proper contact information or there's a problem with the phone number. It's not because we don't have time to get to them. So that's a key point. And then, the interview obviously reveals a lot about where transmission is occurring. And I can just share, some of the stories of the past week. One was that we had two individuals in a workplace who had not identified that they were in contact to one another, but when we reached out to each of them separately, we identified that they both shared a common workplace, and they had also both attended the same social gathering of a baby shower. And the exposure had happened in that setting where they had been together in an indoor gathering. And what ended up occurring was a larger number of cases within that workplace. So it was a good example, and it was a very sensitive workplace. And just for confidentiality purposes, I won't share any more information about that. But it's a setting in which it's potential much more rapid spread within others in that setting, a congregate living facility. So there's again, that was traceable to a baby shower. Obviously, something that we value and do in normal times, but something we can't do now. Another was traceable to a very similar situation where we determined through the interview that two gentlemen had attended the same gathering where they were watching a football game together, which seems like the right thing to do this time of year, but not this year. And that's where, and again, that's contributing, I think, to what we're seeing as this demographic shift. We're seeing more among white residents, and it's more geographically spread across the county. Mill Valley, Tiburon, San Anselmo, Nevada, it's everywhere. West Marin, we're seeing much more geographic distribution, and it's because those kinds of gatherings are happening more widespread.
Those real world examples are really helpful to understand what's going on. So thank you. Next couple just come by way of constituent inquiries. One is that we're hearing from movie theaters regarding the closing of their concessions. Have our contact tracing shown spread in movie theaters locally, or is that becoming evident statewide. So just kind of from the business standpoint, the thinking behind that particular strategy.
Yeah, it's really challenging to have us, the evidence, the local evidence for a specific setting to be true, accounting for cases. And one of the reasons is, with getting back to the interview that happens in contact tracing, is you reach out to someone who may have been infected at some point in the past, say 10 days. And we try and have them recount where they have been in the past 10 days. So they went to the hairdresser, they went to the grocery store 3 times, they went to a restaurant, they went to a movie, and it's impossible to know among that variety of activities they might have participated in, where did it occur? It'd be one thing if the only thing they did was, aside from being in their home, that they went to a movie. We would know for sure. So instead, we have to rely on what we know about the epidemiology and what we know about the patterns of transmission. And the fact is, the reason we close concessions in movie theaters is that it is like indoor restaurants in that it's an indoor environment where people cannot cover their faces. That's one of the themes. If we're trying to think about why we're taking the steps we're taking that go beyond the red tier restrictions. It's those indoor gatherings where people cannot cover their faces are the highest risk. So because concessions, it's dining. People are indoors together. That's why we close that. And that is a common strategy across the state. It's not just in Marin. Across the Bay Area, concessions are closed in movie theaters.
Right. Then finally, sorry. On testing, which you covered, an inquiry has been made concerning the color testing contract, which sounds like it is now not in place. So if you can talk about that. And then in light of that, you went through where we stand on testing, but just your sense of essentially how well utilized our testing sites are and the capacity going forward.
Yeah, so I did go through where people can go for testing resources. I think it's important that anyone who's seeking testing can start with their medical provider and then go to the website that I mentioned, and you'll see some of those other options. The color testing site was one of the public health testing sites by the Canal area. Civic Center. We have another public health testing site in the Canal area, LHI. Those are both similar in that they're public health funded. One is state, one was county, and anyone can go in and just register. We're doubling the capacity at the LHI site. In fact, color testing was doing about 120 tests per day. The LHI site is going to be increasing about 200 tests per day. So we're going to gain more than we lost. Right now, unfortunately, there was an interval of about a week where color had closed. LHI hasn't increased that capacity yet. We're looking to get that back online as close as early as Monday of next week. And it's going to be, a few miles to the south of where it had been, but it's still going to be a public health resource for the community. But I also want to be really clear that it has been very convenient, for people, and that was part of the service that we thought was so important, for people to just go online, schedule an appointment and go get tested. No money, there was never any, it was essentially a free service. That needs to change. It really is moving into core healthcare provision. So we want to make sure that our healthcare providers are offering testing, and that, that service is there, but we really want to protect that service for people who wouldn't otherwise have options for testing. There's enough people who don't have insurance or for whatever reason may not be able to get healthcare testing, testing through their healthcare provider, where we would use that resource for them. So my recommendation and my hope is that Marin County residents now recognize that their healthcare providers can provide testing for them.
Thanks.
Supervisor Arnold. Judy?
You have to unmute.
Thank you, Dr. Willis. I just interested, what is the emotional state of our essential workers here?
Thank you for asking. Yeah, I think people are, I think everyone, this has been hard for everybody. And it's especially hard to sort of realize that we're coming into another climb, another interval. So I would say, I would say that people are tired. They're wonderful. I mean, our hospital workers, we have multiple meetings every week with our frontline healthcare workers. Even though we haven't been seeing surges in cases, it is fatiguing just to provide healthcare in the COVID-19 atmosphere, because everything you do, you've got to remember the PPE and the whole system is altered in ways that just make things more challenging. And there's always the specter of, the risk that they're facing every single day. And that's now 8 months into that. And then to say on top of that, that now we're actually seeing surges, and we have to be ready for hospital and surge capacity, I think has been hard for everyone. And I think to me, it's another example of what we've been learning all along, which is we're in this together, and we have to be working in partnerships, and wherever possible, claim the successes that we've had. We have learned a lot about how to control this. That first curve that we saw in July, we flattened that curve. And that was a hard month. So we know how to do this. And I think that's an important message, is that we know how to do this. If we do the right thing, it's about the fundamentals, right? It's covering your face, it's physical distancing, it's not attending social gatherings, hand washing. Ultimately, that's the best way to control the virus. I mean, it's a natural, the virus has its own, we know how to do this. I think it's just a matter of doing it more. So that I think maybe a message for the community is to do everything you can to prevent surges into the hospitals, because our healthcare providers are already fatigued and are already at risk. And we owe it to them and to one another to do everything to protect them.
Thank you. Give them our best.
Thank you.
Mm-hmm.
Supervisor Rodoni or Sears, anything?
Just to thank Dr. Willis. I think today you had some real important messages about testing, about travel, about gatherings, and I think those are important things to communicate to the public. The real message here is that we control this virus too, and by our actions, and individually we can all make a difference. So I think that was a good part of your message today. Thank you.
And I'll just follow up on that. I really appreciated the question from Supervisor Arnold and Dr. Willis's response. There was an article in the New York Times yesterday about healthcare professionals leaving the field because of the stress of working in that area. And that's about the last thing we really want to see happen, given the importance of healthcare professionals in all ways. And so I really do appreciate that message, Dr. Willis, that it's on all of us, not only to take the steps that we need to fight back the virus, but also to try to help support our healthcare system in the long term. So thank you.
And Dr. Willis, just I think just 2 more points, just to reemphasize the gathering to limit your gatherings to no more than 3 households, and frankly they should be the same 3 households all the time. It's that stable group concept, stable cohort. And then if you could, what would be your messaging to families who have kids coming home for the holidays from college, in terms of those students, their kids' behavior when they get home?
Yeah, I think one is that begins while they're still in college. So we want to make sure that, whatever they may be doing, obviously the messages are not ambiguous, but there's a variety of different ways that people might adhere to those, especially in the college setting. But the first is before you come home, that's when you really need to be on your A game, wherever you are, because that's where if you're really doing the right thing for that week before you travel, you're going to be protecting your family much better. So that's where quarantine at home, quarantine in your college setting for a few days before you come, up to a week before you come. if college, where my daughter's in college, they're doing regular testing, and make sure that if you're doing regular testing in that college environment, to do that testing, 3 days before you travel, so that negative results is fresh, is another important step. While traveling, if you're traveling by air, the N95 masks are less limited than they used to be. They're available actually in a lot of the stores within airports. You can get the KN95 masks. That's a worthwhile investment because that's a mask that actually protects the wearer as much as those around them. So that's another step you can take. And then if you're visiting, grandma, depending on what the environment you're coming back into, modifying your practices so that you're actually having safe encounters with them. I think one of the most important points here is that when families come together, it's often intergenerational, and that our older residents are particularly vulnerable for bad outcomes. In Marin County, 95% of our deaths are among people aged 65 or greater. And that's, and we also know it's a lot to ask if someone travels, but not to see them at all. And so the idea is to, if you do want to visit someone who's at higher risk, to do it outdoors, to do it socially distanced. You can get together with grandma outside, where go to a park or your yard and sit far enough apart, cover your face, and you can have that time together, but in a safer way.
Thank you. So Matthew, you can have a few things I think for us also, and then we'll be going to public comment on the administrator's report and the COVID report.
Yeah, I just want to point out a couple of comments regarding consent calendar B this morning. One, I want to point out that HHS has submitted a revised C1A based on some feedback from the town of Corte Madera.
Can you say that again? Which?
CB1A. And that's based on some feedback from the town of Corte Madera, and be clear around the interim housing component of that service. And so if you could consider that item when you consider the consent calendar B. And then secondly, based on some public request, I'd like to remove CB2 for discussion. That's the sheriff's item, and the sheriff would be available to speak to that when we get to the consent calendar B.
Okay. All right. Thank you.
Mm-hmm.
So Al, we can go to public comment now, and seeing that we've got a lot of folks here today, we'll keep it to 2 minutes, please, for comments.
Okay, Madam Chair, we have speakers. The first speaker is Julia S., followed by Coalition of Sensible Taxpayers in Roby Paulson. Julia S., please unmute, and you have the option to share video.
Hi, hello. My comment was related to what was mentioned about the sheriff. And my name is Julia Sonnerms. I'm a resident of San Anselmo.
Julia, we're going to be on the consent calendar pretty quick, and we will be discussing that item then. So okay. You can wait. That'd be great. Thank you.
I will have to go before then. So I just.
Well, that's how this works. So it should be fairly soon.
The next speaker is Coalition of Sensible Taxpayers. Please unmute, and you have you have the option to share video.
Yes, can you hear me?
Yes.
Okay, this is Mimi Willard, and I had 3 comments that I'd like to make that I'm hoping that Dr. Willis will comment on. The first one is just to encourage and look for your insights into a measured pace of reopening that's sustainable, which I think is really important both for business and the public's understanding of where we are. And we had the situation in June going into July where we had a pretty rushed reopening that resulted in a spike to follow that happened around the July 4th holiday. And we had another pretty dramatic reopening announced on October 27th, only to be toggled back again now. And I just would like some comments about what we can do to just put us on a more stable, predictable trajectory. Number 2, communication. I think it's a little confusing because of this start-stop thing. And that we closed the SIP violation reporting email on September 1, and on October 27th said we're no longer using the term of shelter in place and put an emphasis on individual responsibility. And I'm quite concerned that that kind of sends people the all clear signal to have bad behavior, like all these gatherings that you're talking about, which aren't helping the public health and business side of things. I'm not really sure how best also to get out your communication about the restrictions, because a lot of people don't go to your website. IJ isn't always up to date on this, though they try, but it's not always real time, and a lot of people don't read the IJ. So I hope something better can be done there. And finally,
The next speaker is Robbie Paulson. Robbie, please unmute, and you have the option to share video.
Good morning, Supervisor. Can you hear me?
Yes.
Yeah. Basically, I want to direct towards Willis, looking for clarification right now in terms of guidance towards unhoused community members, people who are living on boats in Richardson Bay, people who are living on Binford Road right now, because what we've seen out on the streets is that once the SIP starts to come back, that tends to make the sheriffs bolder. And right now, I mean, on Binford Road, just the other day, the day after that home key got rejected, those 70 beds got lost, sheriffs came up to the top of Binford Road to a motorhome, unhitched a truck from the trailer of a couple of lifelong residents. The wife has cancer. They took their truck that they used to move their motorhome, stranding them up at the top of Binford Road. And now, now they have to rely on other people to taxi them around. And I'm just questioning, where has your stance been in regards to the sheriff's behavior, and including Richardson Bay, where, back on September 24th, and back in July, when there was those SIP started to come back, we saw threats from Curtis Havel. We started to, September 24th, we saw Haley Allen lost her home, and now she's couch surfing still. And again, that's during the pandemic. So I think you need to be given clear direction and really be listening to those communities right now, because I think what the sheriff's behavior is really uncalled for. And it's going against the interest of public health. Thank you.
Thank you. The next speaker is caller with telephone number ending in 000. Please unmute. Go ahead.
Hello, can you hear me?
Yes.
Yes. Thank you. My name is Kevin Malone, and my question goes back to the pandemic. Does the county feel that we have adequate vaccine distribution infrastructure at this time, refrigeration, and whatever else will be needed in this unique situation? Have you gone out and talked to private organizations like pharmacies, et cetera? The good news is that we do have vaccinations coming, but are we set up to effectively distribute them? And if not, what will the Board of Supervisors do to help implement that efficiently? Thank you.
Thank you. The next two speakers are Elias K, followed by Noah Griffin. Elias, please unmute, and you have the option to share video.
Hi, Dr. Willis. I have a question directly for you. I'm concerned about the number of folks who are essential workers who are facing extreme debt right now, and the moving in and out of the shutdowns are extremely jarring for those people, because when we go into a shutdown situation, then debt collectors have less capability of collecting on debts. And then when we move out of them, debt collectors can then come back and start collecting again, they sometimes don't necessarily understand that the debt collectors, don't follow the rules of this going back and forth. There's lag time in understanding. When we stop shutdowns the way we have been doing here in Marin County and seeing these waves of surges, which I can't imagine that you couldn't have expected this to have happened. We're putting essential workers in a situation, they have to work. They don't have a choice. They have to work to pay their debts. Whereas, there's folks here talking about, well, white people can stay home and this and that. That's not an option for people living in the canal. They have to work. They have to, and healthcare workers are not the only essential workers. Okay, there's all these people packing your goods at Amazon. There's all these people making your food. There's all these people working in the stores. They don't have a choice. They have to go to work. So when you keep opening up like this, you're opening up for white folks to go down to the store and infect a lot of brown people. It's super messed up. And you guys need to be talking about this. And it's just ignored. It's just kind of like, oh, I'll give it 5 minutes. Things got a little bit better for, people living in the canal. It's not the case.
Thank you, Elias.
Thank you. The next speaker is Noah Griffin. Noah, please unmute and you have the option to share video. I think Noah changed his mind. Madam Chair.
No, he's here.
Oh, I'm sorry.
Here.
Oh, there you go.
But we can't hear you, Noah.
Mr. Griffin, we can see you, but we can't hear you. We still cannot hear you.
Noah, we can't hear you. It looks like you're unmuted, but we cannot hear you. So can you come back at open time? All right, thank you.
Madam Chair, we have one more speaker, Rodrigo Izquierdo. Rodrigo, please unmute and you have the option to share video.
Hello there, good morning. Dr. Willis, I wanted, looking at your stats that you showed a while ago, it showed that the Latino community's infections had gone down. And I was just wondering if that has to do with the term herd immunity and the versus reinfection. And that the second one meaning, can a person who already got the virus be reinfected, which will show up in your statistics. So would you comment on whether herd immunity has taken hold in the canal area, because that's basically a super spreader area. There's just no escaping being around a person or building that is used. It's a community place, and they just cannot escape it. It's the same grocery stores. It's the same gas station. It's the same community center. So would you comment on herd immunity and how that might pertain to reinfection? Thank you.
Thank you. The next speaker is Eva. Eva, please unmute and you have the option to share video. I'm sorry, Madam Chair, it looks like Eva changed her mind. We have no additional speakers in the queue.
All right, thank you, Al. Dr. Willis, a couple questions there around vaccine infrastructure, the socioeconomic impact question, which is very important, and then herd immunity. And then the question around guidance for the unhoused.
Okay, so excuse me, vaccine infrastructure. So yes, we are, the way the vaccine distribution works is there's going to be the federal procurement of the vaccine from probably the two main manufacturers, Pfizer and Moderna now, are likely to be the first products to make it to Marin. That will be distributed to the state, and then the state will distribute it to local health departments, as well as local multi-county entities like Kaiser. So we are now in twice weekly conversations with California Department of Public Health to define the statewide vaccine distribution plan and how that would apply to Marin. We have a team that's dedicated to that. We also have weekly meetings with all of our healthcare partners to define not only the vaccine distribution process, but this is something that's been going on since the beginning of the pandemic. And those relationships are historical relationships that have really been strengthened by coming together around this pandemic response. Those are the rails that we'll be riding on when the vaccine arrives to get it out to our communities. The priority right now is actually defining who will be in that tier 1A, they're calling it. That subset of individuals who will get the first doses when they arrive. And that's likely to be essential workers, those who are at highest risk of themselves being exposed. And then within that group, those who are at higher risk of bad outcomes if they were themselves infected. So older healthcare workers and healthcare workers with chronic conditions. And then a combination of those that are at the highest risk for the highest level of exposure, emergency department, first responders, et cetera. So those are some of the conversations that are happening now. Insofar as I think the question was around refrigeration. The Moderna vaccine is going to be, we already have that refrigeration infrastructure in place because it's conventional. It's the way we store vaccines of all types. And that's part of, we will, just amplify that, easier to acquire regular refrigeration. The ultra cold storage and dry ice is something we're all working to acquire. The state is helping us with that. We already have contracts with dry ice companies that can help us with when that arrives. We're looking to implement that, as early as we would be ready, as early as December for that. It's not likely to be really needed until the vaccine, and it's looking like early January, early to mid-January might be the earliest time that within the state of California we would receive vaccine. That's partly because the state has imposed, and I think appropriately, an extra step, which is an interval of independent analysis of the safety and efficacy of the vaccine through a Blue Ribbon Commission that's established by the governor, and includes people I respect a lot in the Bay Area who and others who will be looking at the data and really re-examining the data to be sure that we can stand behind this product before we bring it out to our people. The essential workers question, I think Elias mentioned that I just want to be clear that, the message I was trying to offer and will continue to offer is that as this epidemic shifts in its pattern for us in Marin, and I think is happening elsewhere in the state, we are moving from essential workers into less essential, right? Non-essential activities. And there's a big difference, in terms of those people who are exposed by virtue of an essential work. Essential for us as a community that they serve those functions are grocers, are physicians, all are essential. Someone who's working on the front lines in a grocery store is just as essential in many ways as a healthcare worker because we rely on that for nutrition. And so those people that while they are lower paid are equally essential, and in fact are less free to not do that work because they rely on it to make ends meet. So we have always recognized the disproportional impact on our lower income communities, especially communities of color, and really focus on that as a strategic priority. I think one of the reasons we're seeing success in that is that we have, and this is going to combine with Mr. Izquierdo's question about herd immunity. One of the reasons we're seeing success in fewer cases among our essential workers is that there's been a lot of work to make sure that they have the resources they need to not work if they're infected with income replacement, that we have housing available for them, that our contact tracers are reaching out and offering them those resources as early as one day after their infection is recognized. And the collection of those things over time, combined with a lot of the messaging that's gone out through the Canal Outbreak Response Plan and now Novato Outbreak Response Plan, or Outbreak Prevention Plan in Novato. I don't want to say we're having an outbreak there, but we're trying to prevent it. Those messages have also taken hold, and the adherence to facial covering, I'm here in the Canal now where my office is really good. I mean, people walking around the community, you don't see people without masks. And that's partly, I think that whole constellation of strategies has really contributed to the decrease more than herd immunity. To Mr. Escardo's question, we've worked with Marin Community Clinics to do antibody testing for all of their patients. They serve our Latinx community. And we saw between 15 and 20% of individuals who live in the Canal area, which was really very high prevalence community, about 15 to 20% of those residents of a few hundred that have been tested in community clinics with antibodies have those antibodies. So 80% or so still do not have antibodies. So that community remains vulnerable. So it's not due to herd immunity. There may be some fractional benefit from an immunologic standpoint that some have already been infected because they're less likely to be reinfected. But it's really more based on the strategies and the interventions, I think, is the credit for now a 5 to 3% positivity rate in that community where it used to be, up to 40% positivity. The pace of reopening question. I think there was a suggestion that this feels herky-jerky in terms of opening and closing. And that's obviously, I think, part of the national and international dilemma with this pandemic response is we're trying to balance the economy and allowing things to be as relaxed as they can be, offer people as much freedom as we can, but then also recognizing that the things that prevent transmission are limitations, are restrictions, are less travel, are less commerce. Closing things is one of the ways that we actually control the pandemic. And it's just a constant dance between those two competing values. And we're doing our best in Marin to do that. We've done that through the Marin Recovers Group. I would suggest that we've navigated this relatively successfully, given that we have been following the orange tier policies for the past month. Unlike a lot of other counties that chose to have more restrictive policies, despite being in the orange tier, we've had lower increases in case rates than most of the counties around us, despite the fact that we have had some of the more open policies. We've opened schools, 70 schools open in Marin County, but we haven't seen the surges that we're seeing in adjacent counties that didn't open schools and had more restrictive policies. So to me, that's where the nugget is in terms of the hope that we're doing something right that we can hang on to and do more of that might be particular to Marin. And I think I'm hoping that it's a cultural norm or an awareness within our community of really the way in which we protect one another by taking those everyday measures of physical distancing, covering our faces, and hopefully, and this is the key point, not attending indoor social gatherings. Are there any other questions you wanted me to address, Supervisor?
I think that the last one was just around guidance for the unhoused.
Yeah, I mean, the unhoused, our housed, it's the same way we protect ourselves in the same ways, right? And we protect those around us in the same ways. So we cover our face, we socially distance. The virus will not transmit between two individuals if they're not close together with no face, if people are close together indoors without facial covering, the virus will transmit. It doesn't matter whether you're housed or unhoused, or whether you're rich or you're poor. That's the way the virus gets transmitted. So we want to make sure that people who are unhoused also have access to all the resources to protect themselves and those around them, facial covering, social distancing, et cetera. We've also, I think, recognized that there are fewer opportunities to make safe choices for people that don't have those freedoms, especially unhoused. And so we've offered housing to our unhoused population. The COVID-19 pandemic response, if it has any silver linings, and there are some, one of them is what it's done to really jumpstart our effort to get people who are living on the streets into housing. And we have been successful in doing that. We've moved dozens of people who had been previously unhoused into housing as part of the pandemic response. And we've had special funding to be able to do that. So the new resources coming on board to do that. And that will be a lasting positive legacy of this interval. And so again, I think the message is the same messages that we're offering everyone. And then, and the other message is for us in terms of civic leadership to make sure that the resources are available for people who are unhoused to get into housing.
All right, thank you, Dr. Willis. We really appreciate all your work and also your really clear and thorough answers and communicating out to us and to the public. Really important. So have a good rest of your day and rest of your week.
Thank you.
So we are moving on to